families and people with food as medicine and other lifestyle interventions. And now that he's retired, in inverted commas, he's spending his time providing education to health professionals and the public on whole food plant-based diets and other lifestyle interventions for reversing disease. So big welcome, thank you.
Thank you so much for that lovely welcome, and thank you to the ProVeg organizers for putting on this remarkable program and for inviting me to be part of it. It's a real sign of the times. It gives me great hope that all of you are here, open to this very, very important issue. I've been a primary care physician for the past 47 years. After 9 years of regular blood and guts medicine, my heart and my head told me it's time to stop eating animals, and I became vegan in 1981 and began practicing plant-based medicine after I saw the amazing changes that happened in my own body. A 10 kilo spare tire of fat melted off my waist, my high blood pressure came down, my high cholesterol came down. I felt great waking up in a nice lean body every day. And so I brought that to my medical practice, and for the past 35 years been helping people get themselves healthy for a plant-based diet. This is such a powerful, profound process that every physician ought to know about it and use it in their practice. And yet, I am appalled at my profession. I'm embarrassed by my profession. Their complete lack of openness to this most powerful modality. And for that reason, I have devoted the rest of my career to going around to the medical schools of North America, Australia, New Zealand, and on this continent, bringing the plant-based message to the medical students and helping to prevent a disease that is rampant among medical students around the world as they learn their basic sciences. And it's a disease that I have called pharmacosclerosis. And there's got to be a medicine for every disease. And I want to reach them before pharmacosclerosis sets in their brain. And so I get up to that microphone and I tell them I'm going to give you the lecture I wish someone had given me 50 years ago when I was a first-year medical student. And that is, listen, you're learning how to diagnose everything from leprosy to smallpox. But believe me, that's not what you're going to be seeing when you open the door to your general practice office, to the emergency room, to the surgery outpatient clinic. You're going to see a large group of people sitting in front of you with a small group of dismal degenerative diseases, largely from what they're eating: obesity, clogged arteries leading to high blood pressure, high lipids, type 2 diabetes, angina, etc., and a whole bunch of inflammatory diseases affecting lungs, skin, GI tract. This is what you're going to be seeing. However, when you ask your professors what's the cause of these diseases, when you look in the textbook for the cause, you're going to run into two words that stop all further thought: etiology unknown. We don't know what caused these diseases. We're still researching the cause of type 2 diabetes. We're really researching the cause of clogged arteries. And if you don't know the cause of a disease, you can't really treat it well. So that reduces the doctor to the role of managing chronic disease. I'll manage your high blood pressure. We'll manage your diabetes. I tell the students, I don't know about you, but I did not go into medicine to manage chronic disease. I wanted to cure people. And every single one of these diseases is reversible. And I don't want to manage them. I want to cure them. And in fact, the truth is, we do know the cause of these diseases. You don't have to look any farther than the nearest fast food restaurant. The cause of these diseases, of course, is the food that we're eating. And certainly it's happening in my lovely continent and North America, but it's certainly happening here, of course. And the fast food intake in this country has really increased on every level. And the results have been predictable. Of course, your obesity rate, just like our obesity rate, is going through the roof, along with all the expenses needed to deal with all the complications. So I go around, I was introduced with, now that I've retired, I'm working harder than ever. I've not retired, I rewired. And the message I want to get out to the med students while they're still impressionable is that people need to understand the effect of their daily diet. Nobody mentioned this to me in medical school, but what every meal does to us is the key determinant of health or disease. And so as far as what every doctor needs to know, and actually I'd expand this to what every doctor and patient needs to know, there's 6 points I want to get across. First of all, nutrition changes everything. And I mean that on the absolute physical level. I'll tell you about it. And because this is the Pro-Veg conference and the VegMed conference, I'm free enough in this audience to come right out and say we're talking about plant-based nutrition. Changes everything. The body is fundamentally different when the food stream running through your tissues meal after meal is totally plant-based versus an animal-based. And I'll tell you the profound differences between the two. Plant-based nutrition is the key to understanding disease reversal, because these are reversible diseases, but it can be a difficult sell. My colleagues, they want that hard evidence, they want that randomized placebo-controlled double-blind study showing that cheeseburgers will hurt you, and our patients, man, they hold on to those burgers and buffalo wings really firmly. It's hard to pry them out of their still warm fingers, but it's the key to making medicine fun again. So many doctors are leaving. All my patients, whether it's a cardiologist, a surgeon, a rheumatologist, they're all just getting fatter and sicker. That's right, doctor. If you don't talk to them about what they're eating, that's exactly what you're going to see. But if you get them on a plant-based diet, these diseases go away, and you need to know that. And nutritional counseling needs to be complete. It's not a haphazard undertaking, but easy to learn, easy to refer to your colleagues. And it's the way forward for not only our profession, but our species, which we will touch upon at the end. So let me share with you that I want every young doctor to understand the fundamental difference between plant foods and animal foods in the body. When you eat a meal made of whole plant foods, they have a nice big salad, vegetable bean soup, quinoa, zucchini bones, steamed green and yellow vegetables. When you eat a meal like this, I know I'm talking fast, I ran over 20 minutes yesterday, so I'm trying to get it all in. It's important stuff. Now, you're all going to get the PDF slides from all this, so relax. You'll be able to put this together from your own head there. When you eat a meal like this, and if an hour later I were to sneak up on you with a needle and a syringe in my hand, and when you weren't looking, I drew 5 cc's of blood into a glass tube, let it clot, spin it down in the centrifuge, and then look at the blood, it would look like this. The red clot goes to the bottom, the liquid part goes to the top. And the serum up here should be crystal clear. You can read newsprint through normal serum. This is what your blood should look like after a meal. It's what all your blood should look like after this lunch today, unless you slipped out to Mickey D's across the street. This is what your blood should look like after a meal. But you have a meal of typical Western fare. You have a burger, fries, and a shake. The heavy saturated fat in the beef, the butter fat in the cheese, the egg yolk and the mayonnaise, the vegetable oil in the fries, the butter fat in the ice cream. All this fat oozes out into your blood. And for the next 5 hours, your blood looks like this. This creamy appearance is called lipemia. The word means fat in the blood. And your blood stays fatty for 5 solid hours. Now, not everybody shows the fat as optically densely as this, but everybody has a wave of fat that goes to your bloodstream after you eat a fatty meal. How can you not? Where else is it going to go? And I was serious about that 5-hour number. Here's Kula's classic study. They gave someone a fatty meal at hour 0. Then they drew blood once an hour for 6 hours. They took those 6 blood tubes, put them one after another into an instrument, measuring how fatty the blood is getting. You see the blood getting fattier, 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 fattier. It takes the liver a good 5 hours to begin to clear the fat out of the blood. So what does that mean? Well, think about how most Westerners run their eating day. They start their morning off with something fatty and turn their blood fatty, and for the next 5 hours, the artery walls are getting injured, setting the stage for atherosclerotic plaque formation. Now it sticks to their fat stores, they get obese, it clogs up their insulin receptors, as Dr. Barnard told us, they get more diabetic, and the saturated fat inflames inflammatory reactions throughout the body. This goes on for 5 hours. It takes till about noontime for the liver to begin to clear the breakfast fat out of the bloodstream when it's time for lunch, and send another wave of fat to the bloodstream. The blood stays fatty all afternoon, clogging your arteries, making you obese, making you diabetic. It takes till about 6 in the evening to begin to clear the lunchtime fat out of your blood when it's time for dinner. And even if you have a piece of salmon steak, but most people have a piece of beef, your blood stays fatty all evening till about 10 o'clock at night, till on the way back to the bedroom you polish off that half pint of Haagen-Dazs. And the reality is most people in the West are keeping their blood fatty all day. Stuff never clears out of the bloodstream. Keep your blood fatty 20 years, 30 years, 40 years. You can't be shocked when some really scary changes start happening in the body. Now, I mentioned meals like these, as they flow through your abdominal fat stores, tend to stick there and make you obese. In the space of my medical years, I've seen this tsunami of obesity sweep through the public, including in this country. And people, instead of getting alarmed about it, they just accept it. Well, we're fat now, doc. That's just who we are. And you got a problem with that. That's your problem. It's not my problem. I feel good, even though I got this big belly. As a physician, let me just say, these people should not be smug or complacent. This is not a state of health. If you take that big abdomen and slice it in half like this plastic model shows you, you see what's really in there. 2 kinds of fats in the abdomen, neither are your friend because they're both metabolically active. Underneath the skin, the subcutaneous fat produces estrogens. It is the largest estrogen secreting tissue in the body. If you're a woman with a breast lump, or you're a guy with prostate cancer, the last thing you need is 30 pounds of estrogen-producing fat plastered on the front of your abdomen, producing these growth-promoting hormones. But inside the abdomen, different kind of fat that surrounds the intestines. The visceral fat here produces a whole host of molecules called inflammatory cytokines. They fan inflammation throughout the body, and you just need to walk through this list of diseases that are made worse by inflammation, and you can see why having 30 pounds of inflammatory molecule producing fat in your belly is not a good idea as well. These people should not plead for acceptance. They should search for a way to melt that fat away, and keeping your stomach full of whole vegetables is the way to do that. But my concern as a doc is that there's a lot more in that fat, except there's a lot more in that blood besides fat. There is an evil brew of molecules from the diet. This is always a processed food diet. It's going to be a high sodium diet that not only stiffens your arteries and makes you retain fluids that will raise your blood pressure, setting you up for strokes and heart attack, but we now know that all this excess sodium turns on genes that set you up for autoimmune diseases like lupus, etc. Now, we then come, the unhealthy food stream, to eating sugar as a food. And this is a real issue. We all love that sweet taste on our tongue. And I've got no problem with sugar per se when it's used in its proper form as a flavoring. Sugar is a flavoring. It was never meant to be eaten as a food. And a half a teaspoon of maple syrup in your tea is not going to cause you any harm. But you eat a piece of cake, you eat a candy bar, a donut, drink a Coke, have these cookies, you flood your tissues with sugar. Not a good thing to do. Why? Because the sugar sticks to the proteins throughout your body, and bad changes happen. Every baker knows this reaction, the Maillard reaction. You take the sugar of pastry flour, stick it to the protein of gluten, and then put it in the oven, and the sugar sticks to the protein, they oxidize, and it forms the classic brown bread crust, which is fine on the surface of a French baguette. This is all bastardized, congealed protein. Fine if you're baking bread. You do not want to run the Maillard reaction in your body. You drink that Coke, you eat those cookies, you flood your proteins with sugar, and your own body heat your own body temperature provides the heat, and you run the Maillard reaction in your own tissues. You don't want to run the Maillard reaction in the lens of your eye. It's a great way to give yourself cataracts. You don't want to run the Maillard reaction on the elastic fibers in your skin. It's a great way to create skin that looks like an old suitcase. You don't want to run the Maillard reaction in the inside of your blood vessels. These are the membranes that oxygen has to pass across to get into your tissues. Eating sugar ages you. It produces these called advanced glycation end products, which is what this is. Don't worry about the name. Remember the acronym. Eating sugar as a food ages you. You want something sweet, have a mango, have an orange, but don't be eating concentrated sugars as a food. So this is why I'm not a big fan of vegan junk foods, because they hurt us in many ways, including aging our tissues with all their sugary junk. Now, those are all nutritional hazards from a plant-based diet. Those are all vegan treats, but you see how they age and hurt us. That's bad enough. And I've seen plenty of sick, unwell vegans. But to all the rest of the people in the UK and the US and around the world who are still eating those meat-based meals, you got to realize that when you choose to base your diet on meat, when it appears in your diet on a regular basis, you are now open Pandora's box to a host of disorders that are solely from the eating of cooked animal flesh. Let's go through this dreadful list. Nobody eats raw meat outside of the beef tartare fans, and so the very act of cooking animal muscle oxidizes the cholesterol that's in every muscle cell. As a result, you wind up with lots of oxidized cholesterol particles. Well, oxidized cholesterol is atherogenic. These are the particles that get into the wall of your artery and set off this dreadful atherosclerotic plaque formation. So one good reason right away you don't want to be eating cooked animal muscle. But also, cooking animal muscle oxidizes the proteins and nucleic acids, and that releases a host of what's called reactive aldehydes. And these are mutagenic. These hurt your genes. These rip up your DNA. And every burger, every hot dog, every lamb chop unleashes a torrent of these molecules to your tissues. Then, as Brenda mentioned, there's a sialic acid called Nu-5-GC. Only animals make this, but it sets off inflammation throughout the body. If you stain for it, you can find sialic acid in all these dreadful diseases. And then there's endotoxin. This is the yuck factor, but people got to get real about it. Reality check. All meat comes from the slaughterhouse. Even organic grass-fed beef, they all pass through the slaughterhouse. And in the slaughterhouse, when the animals are hung up on the racks and eviscerated, their digestive system ripped out, the gut bacteria spill all over. And as a result, if you take a culture tube, and on every cutting surface in the slaughterhouse, you can culture off E. coli, Salmonella, Shigella, Enterobacter, all these enteric bacteria that will make you sick. But they'll say, well, how does that affect us when we cook the meat? The problem's this. As I mentioned, every cutting surface in the slaughterhouse is coated with bacteria. And that means every steak, every chop, every chicken breast, it has a coating of these bacteria on the surface. They're then put into cardboard, wrapped in cellophane, sent to the supermarket, where it's put in the meat case under the ultraviolet light, which is there to kill bacteria, and it does. That's the problem. Because when these bacteria die, their cell walls break apart and release this nasty lipopolysaccharide called endotoxin. Anybody here heard of endotoxic shock? This kills people in the intensive care unit. This really rips up all your internal organs. Well, endotoxin's heat stable. Cooking the burger does not get rid of it. And if you think that this is benign, just take a walk around this dreadful daisy here, and you see that endotoxin releases free radicals, starts clotting your blood, depresses your heart, releases histamine, nasty, nasty stuff. And our paleo friends and our keto friends are giving themselves a shot of endotoxin 3 times a day and Nu-5-GC 3 times a day. This is not healthy human food. And endotoxin makes your gut leaky. And that allows food proteins to leak into your bloodstream and flow through joints and set off a reactive arthritis. Endotoxin's not friendly stuff. You don't want to be eating it. You don't find endotoxin on broccoli. And then there's a TMAO that several of the speakers have mentioned. And what the lesson of this is that the food you eat determines the microbes that live in your gut. You eat a bunch of sugar, you're going to summon up sugar-eating microbes. Well, you eat a meat and egg-based diet, you're dropping big bolts of carnitine and choline down into your gut 3 times a day, you're going to spawn a whole host of microbes that eat carnitine and eat choline. They have names like Streptococcus and Clostridia. They don't care about you. They're waiting for that next salmon steak or chicken breast to come down. They will take that carnitine and choline and turn it into trimethylamine, which your liver oxidizes into trimethylamine oxide. This is a molecule from hell. This drives cholesterol into the artery walls and keeps your HDL from pulling it out. And already there's been studies showing that the paleo folks have twice the amount of TMAO in their bloodstream. And these are the guys who are going to just drop dead on the elliptical trainer at the gym with their 6-pack abs, but arteries of an old man because of all the TMO they are spawning in their arteries and in their gut. The very act of cooking animal flesh creates these carcinogenic heterocyclic amines that Brenda Davis spoke about. And due to the shape of the intestine, these fecal masses filled with these carcinogens get a long time to rub on the colon wall, and that's why the meat eaters get these colon cancers sprouting out both on the curve of the stomach and in their descending intestine. And the heme iron that the bodybuilders, get my iron by eating that red meat. Well, this stuff, the body can't keep it out, and it just flows freely into the tissues. And iron, as your rusty car bumper will tell you, is an oxidizing agent, and it oxidizes tissues throughout your body. Iron overload is a real hazard to men and postmenopausal women because we can't get rid of the stuff. And it sets people up for strokes and actually fans cancer growth. And finally, the animals in the feedlots are fed grains that are sprayed with herbicides and pesticides and antibiotics by the bushel every day. And the water they drink is contaminated with mercury, cadmium, lead, arsenic. It all winds up in the meat. And, well, I'll just have fish. We've been treating the oceans like sewers, and the fish are largely contaminated with mercury and pesticides and dioxin and the current villain of the environmental concerns, the microplastic. All the salmon's filled with these type of substances. So this is a reality. Question for doctors and who people eat. Does your blood carry these molecules day after day, or doesn't it? The meat eaters are keeping these molecules percolating through their tissues, through their blood vessels, through their nerves, hour after hour, meal after meal, day after day. If your diet is vegan, the answer is no. These molecules are not in my tissues. But to the doctors and to the patients, people who eat, the question is, does your bloodstream carry these molecules day after day, or doesn't it? In my country, the Colorado River cut the Grand Canyon day after day after day after day of flowing. This is the power of persistence. Well, meal after meal after meal after meal of these contaminant-containing foods for 10 years, 20 years, 30 years. Then suddenly the doctor is shocked. Whoa, you're all inflamed. No wonder your joints hurt. Oh, your arteries are all clacking up. Oh, how did you wind up with that leaky gut? Gee, we don't know why you suddenly sprouted out with lupus here. Gee, that colon cancer, boy, bad genetics. Luck of the draw. Too bad. Nothing you could do about it. And this is the nonsense that patients are fed. When the cause is right under the doctor's noses, but they refuse to look at the reality of it. And that brings us around to our paleo friends and their cousins, the keto guys, who are packing their intestines full of meat 2-3 times a day and think they're living like their caveman ancestors. I'll tell you about that in a minute. But the reality is these folks are likely setting themselves up for an epidemic of colon cancer and vascular disease, heart attacks, strokes, autoimmune diseases, diabetes, inflammatory bowel disease, colitis, Crohn's, dementia. This is a diet of death. And now people often get better. And I hear this a lot. Well, I put my patients on a paleo diet, they get better. They lose weight, man. Their blood pressure comes down. Their lipids get better. Their diabetes gets better. And man, it's a healthy diet. And patients get real reinforcement from this initial improvement. But I tell both the patients and the doctors, don't be seduced by this initial improvement. Why do they improve? Because the paleo folks, as Brenda Davis said, do some things we agree with. They say no caveman ever milked a dairy cow, so they're down on dairy. Yay, paleo, they're right. No caveman ever squeezed the fat out of olives and poured it on their salad. They're down on oils. Yay, paleo, they're right. And they say no caveman ever ground flour and wheat into flour and made donuts. So they're down on flour products. Yay, they're right. And so you eliminate the dairy, the oil, and the flours from anybody's diet, and man, they're going to trim down. They're going to lose weight. And that weight loss will make their diabetes better, make their lipids better. Yay, they get this initial improvement. There, you want to eat paleo the rest of your life? Yes, doctor. You want to eat keto the rest of your life? Yes, doctor, and they do. That's where the problem comes in. Because I tell my fellow physicians, listen, healthcare in the 21st century is episodic. The odds of you seeing the same doctor when you go back to the clinic are small. People move away. You got to start with a different doctor. Doctors move away. You wind up with a different doctor in clinic. And that doc who recommended you ought to eat paleo, ought to eat keto, he's long gone. You'll never see him again. But you keep loading your colon full of meat 3 times a day. And then so I asked those doctors making this recommendation so casually, you're going to be around in 10 years when this patient passes his first bloody stool from their colon cancer that your diet spawned. You won't even see that. You're going to be around in 12 years when this woman has her stroke from that carotid artery plaque that your diet spawned. You won't be around to see this. You think you've done something good for her. You're going to be around in 12 years when this fellow's joints light up from the inflammatory arthritis that the leaky gut from your diet has spawned. You won't be around for all this. You think you've given them good advice. This is not good advice, and they should not be dispensing this. So I asked them, what diseases is this eating style you're advocating brewing in your patient's arteries? What's it really doing in their colon wall? What's it really doing in their breast and prostate tissue? What's it doing to their immune system? You don't know, doctor. Nobody has eaten this kind of flesh-based diets steadily for 20 years, 30 years, 40 years. They're all shooting in the dark. We know that plant-based diets were good for a lifetime. As the Blue Zones tell us, you live 100 years or more on a plant-based diet. But these folks are all just blowing smoke as far as they think this is absolutely healthy. This is what our caveman ancestors ate. I'll tell you about that in a minute because they didn't. And I'm embarrassed by my profession. I'm angry at my profession. We practice medicine like what our patients are eating has no effect on these diseases that they are bringing to us. So when we treat them like in the Harry Potter movies, Voldemort, the name that must not be spoken. We treat nutrition the same way. Oh, don't ask what the patient's eating. We're free to eat whatever we want. Don't tell people what they eat. That's the nanny state. Yes, ask them what they're eating. That's why they're sitting in front of you, obese and diabetic and hypertensive and clogged up and inflamed. From the freaking food they're running through their tissues every 4 hours. Yes, doctor, you're scientists. They can identify the genetic mismatch on gene 821 on chromosome 14. Boy, they can home in on that with precision. But the thought that cheeseburgers and pepperoni pizzas might be clogging up their patients' arteries, this is too abstruse a concept for them to understand. It's outrageous for scientists who ought to know better. I tell them, listen, your body's never not looking. You can't eat a cheeseburger and what was that? No, I didn't do it. Every meal changes us on a molecular level. Whatever you eat within minutes is flowing through every tissue in your body where your DNA lies unfolded. And molecules of that food flow across your DNA, and they play your DNA like a piano. And it turns genes on, turns genes off. And it turns enzyme on, turns enzymes off. Every meal changes us on a genetic molecular level. Here you see prostate cancer cells that have been stained. These red panels here, these are oncogenes. These are cancer-promoting genes that are turned on. Patient went on a whole food plant-based diet for 6 months. Another biopsy was done, and these active oncogenes got turned off. Food turns our genes on and off. We can't ignore that. It changes us on a level. You don't need to be a geneticist to understand that the genes are going to be turned on by this food and all the toxins it contains running through your tissues and the diseases it produces. are going to be a fundamentally different set of genes than those that are going to be turned on by this food containing all these antioxidant phytonutrients that promote tissue repair. It's the difference between 1 and 0 in computer language. It's all the difference in the world. A plant-based diet versus an animal-based diet. We can't ignore that. Your genes may load the gun, but your diet and your lifestyle pulls the trigger. You may have a genetic propensity in your family towards a disease, but whether that disease actually develops in your body depends on the food you're flowing through your tissues. Food will change you in 2 ways. It will change you either directly, the way the molecules turn on inflammation, like U5GC, or it will change the microbes in your gut, and they will change you from the neurotransmitters they put out, changing your emotions and a lot of other things in your body. Comes down to the cartoon my cardiology friend Baxter Montgomery in Houston did. From the tree trunk of bad nutrition comes all this evil food, heart failure, headaches, obesity, diabetes. And I tell my colleagues and patients to practice medicine without caring about your patient's nutrition reduces the doctor to the blind men and the elephant situation, where the blind men have a different part of the elephant. They each drawing their conclusions that the elephant's like a rope or a snake. But they all have hold of the same elephant. None of them have the faintest idea what a whole real elephant is really like. Well, that's the problem with all these diseases. The specialists are sitting in their cubicles, and as this toxic food stream bubbles through all the different organ systems, the cardiologist sees the clogged arteries, and the internist sees the high blood pressure, and the endocrinologist sees the type 2 diabetes, and the physiatrist sees the inflammatory arthritis, the rheumatologist sees the lupus, the neurologist sees the dementia, the dermatologist sees the psoriasis, the gastroenterologist sees the Crohn's and the colitis. Guess what? They're all looking at the same disease, what their patients are eating. And to ignore this is stunning, because you get these folks on a plant-based diet and these diseases go away. I wish I had more time to linger on this one, but here is what the plant-based diet does. Here's why it is so effective. First of all these oxidizing inflammatory molecules, gone. You've given your body complete relief from it. And you are bathing your tissue with every meal with all these lovely healing phytonutrients that promote tissue repair. And that produces changes in the body. The blood is less viscous, it flows better, delivers oxygen better. The fats in your tissues are less inflammatory, less oxidative stress. The potassium levels go up, so your adrenals put out more anti-inflammatory hormones. The good bacteria are spawned in your gut. That then improves your mood. Your skin oils change. The acne gets better. Hormone levels go down, those pathogenic estrogens, and the growth-promoting hormones, IGF-1, TNF-alpha. Kidney function gets better. Everything tends to get better because it's the food we're meant to run on. So every doctor and patient needs to know that a diet with porridge and fruit in the morning, if you're hungry, if you're not, just drink water. And hearty vegetable soups and big salads and steamed veggies and healthy stir fries and healthy breads and fruits. This is the magic formula that produces these stunning changes. And this is the final payoff. When you get someone, and I've seen this literally hundreds and thousands of times in my 35 years of plant-based nutrition. You get people on these plant-based diets, whole food plant-based diets, and within days, the obesity starts to melt away. The arteries open up. The high blood pressure comes down. The joints stop hurting. The skin clears up. You saw this in Gemma's patients. Their bowels start working well, as Dr. Desmond will tell you. Their skin clears up. Their migraine headaches get better. Their asthma gets better. They turn into normal, healthy people that don't need a lot of pills and potions and procedures. And I tell the medical students, isn't this why you went into medicine? What greater gratification. You don't want to just manage their hemoglobin A1Cs. You want to turn these people into healthy people. And what they're eating is the key to either this body or that body. Get real about it, and you'll finally be the physician that you really want to be. These are reversible diseases. That means the symptoms go away and the lab values normalize. And so let me just take you through some of these reversible diseases. You've seen them already. Inflamed joints. Kelson Grog showed us back in the 90s that patients put on whole food plant-based diet. Within 4 weeks, their joints are better, their blood tests are better, their benefits lasted over a year in the folks who stayed on that diet. There's Lindahl's asthmatic folks, they had 35 asthmatic patients who got them on a vegan diet, significant decrease in symptoms, 92% were better in a year, medication withdrawn or drastically reduced in all of them. Diabetes, you already heard Dr. Barnard today, and Brenda spoke about it. But all of us, docs, who practice lifestyle medicine with plant-based diets as the center, we have a stable full of patients who used to be obese, who used to have high blood pressure, who used to have diabetes, and you get on a whole food plant-based diet and taking a walk every day, and these kind of guys turn into these kind of guys. Isn't this the most powerful medicine going? What more can you possibly ask? Skin diseases we frequently. Acne is made worse by the whey protein in milk products. Get the milk out of their diet. You stop stimulating this gene that makes their skin oils really acid. Skin tendency to clear up. Psoriasis gets better. And then the classic study in cardiology. It will melt away plaques. Here's the artery wall, keeping your diet, your bloodstream filled with all the antioxidants from the kale and the broccoli and the sweet potatoes. They penetrate into the wall, these antioxidants penetrate into the wall of the artery. They neutralize the free radicals, these evil old goblet cells, foam cells that had all these oxidizing substances. They leave, they out-migrate. There's no more need for them to be around. As a result, the plaque gets smaller and smaller and smaller. The endothelial lining reestablishes itself, not by magic, but because your bone marrow is constantly putting out showers of stem cells that reupholster the artery walls like new paving stones. And Dr. Esselstyn published this. We had hoped the cardiology world would be welcoming of this. They weren't, surprise, surprise. But as soon as they saw an artery like this, after 22 months on a plant-based diet, this artery turns into that artery. Every cardiologist who read that should have closed the journal, picked up the phone, and called Dr. Esselstyn, said, how did you do this? I want to share this with all of my patients. The cardiologist didn't take advantage of it, but you can. If you've got someone with artery disease, have them get Dr. Esselstyn's book and follow his recommendations specifically. So, our colleagues, they want hard evidence. They're not going to get it in the form that they think. They want that randomized placebo-controlled double-blind study. Nutrition doesn't lend itself to that. You can do those studies when testing a new drug. You can give the patient a placebo drug. They don't know which drug they're getting. Nutrition, people know if they're eating steaks or they're not. They know if they're eating pizzas or they're not. And plus, these have to be 30-year studies, 40-year studies with people eating the same diet through all 30 years. Humans don't do that. You're not going to get those kind of studies. There are studies that can be done and give very convincing evidence. And if you're interested in this, look up the True Health Initiative and see what Dr. David Katz is writing about all of this. But our colleagues in medicine have to expand their understanding of what constitutes proof. But their patients should constitute the proof. Their patients will get healthier, like Gemma showed us right before their eyes. The patients love their burgers and French fries. There are counseling techniques that the doctors can use. They're all wonderful, should be explored. But I put the food in their mouth. I'll refer them to my vegan chef friends who will put a dynamite bean chili or a tofu lasagna in their mouth. And Joe Beefeater says, ooh, that's not bad. If that's vegan food, I could eat that. Wow. Man, you change their lives with that. It takes us worth 1,000 words. So whatever it takes to help people make that move, help them do it. Doctors say, well, people don't change. They do change. They're sick of being sick. They're scared of dying. And it's in the air. It's in the zeitgeist. People know, they get a feeling of what we're happening. Here's my patient, Ken, 12 weeks, dropped 10 kilos, got off all his meds. This guy turns into this guy on a whole food plant-based diet. And here I am going to medical schools and talking to the students. Like this is something unique. It is not, it should be unique. The principles of medical ethics from the American Medical Association tells us that a physician shall continue to study, apply, and advance scientific knowledge and make relevant information available to their patients. We're told to share this, and to their colleagues, which is what I'm doing, and to the public, which is what I'm doing here today. It's unethical, literally, it's a loaded word, but it's unethical to withhold this from our patients. And it's going to just be a matter of time before some angry widow walks into the office of a cardiologist or cardiothoracic surgeon and says, my husband died on that operating table last week during a 4-vessel coronary artery bypass, and nobody told us he could have melted those plaques away from the inside. When did you people know this? Why was this information withheld from us? How long has this been in the medical journal? 20 years. Why didn't someone say this to him and to me? And she'll file a wrongful death suit, and she will win it, because that would be a wrongful death. These are all wrongful deaths on some level. So, what do I tell the medical students? I tell them, before you order another 1,000-pound scan, another 500-pound set of laboratory results on your overweight, diabetic, hypertensive patient, stop. Ask them what they ate yesterday. Say, take me through your typical eating day. What do you have breakfast, lunch, and dinner? And listen. And if it's full of burgers and buffalo wings and bacon and eggs, that's where to start. Send the patient to, I tell them, listen, I have a little 3-page handout. I say, as they're going out the door, because doctors say, I don't have time to counsel. You don't have to. Make up a nice little handout, and on the way out the door, say, by the way, you want to get rid of your diabetes? You want to get rid of your high blood pressure? You want to get rid of your lupus? You want to get rid of your psoriasis? Here, check out these. You'll have this in the PDFs. I'll make sure you get these. But check out these videos, see these films, read this article, and then I want you to go see the plant-based dietitian. I'll tell you about her in a minute. Because you have to do some real counseling. These folks do have to look after their B12, iodine for their thyroid, the vitamin D, as was mentioned, omega-3s. If you're interested, go to my website, drklaper.com, and see my video, Thriving on a Plant-Based Diet. It goes through all of that. But I mentioned plant-based dietitians. I'm so grateful to see these folks appear. And in America, you just Google plant-based dietitian. All these lovely folks that have RD after their name, they're official dietitians. And they will do the counseling. And that's so important because it takes the doctor's excuses away. The doctor said, well, I don't know anything about nutrition. I don't have time to do this counseling. I don't get paid for it. Well, the beauty of this, you don't have to, doctor. Just realize that person sitting in front of you, obese, hypertensive, diabetic, and inflamed, is there because of what they're eating. Send that patient to Ms. Smith, the plant-based dietitian. Let her do the counseling. Let her show them the videos. Let her take them shopping. Let her follow up. And then you see them back in a month and see if they haven't trimmed down and aren't doing better. Well, that's America. Yeah, but it turns out that, as Brenda showed us here and Gemma showed us, British dietitians are starting to get on board. They begrudgingly agree that vegan diets, it was begrudging a few years ago, they're getting better, can support healthy living. Here's the London dietitians. They're around. And if you want these people to help, you need to call and screen them yourself, because many of these people are still in the paleo-keto camp. And so you've got to ask, I want to do a whole food vegan diet. Can you help me? Do you feel comfortable doing this kind of counseling? And you let her declare so you don't get seduced when you walk in there and get surprised. But we need to bring these dietitians along so they step up and do this very important job of counseling. It's never too late, as that older man in Gemma's video showed us. Everybody should, if you haven't already, go see Forks Over Knives on Netflix. It'll change your life. And then go to their website. Well, what do I do next? Go to their website, and they got a wonderful food program that will guide you through it. And finally, it's the way forward for our profession and our species. These folks pushing paleo diets, everybody ought to be eating keto, everybody ought to be eating meat 3 times a day. Are they seriously proposing a flesh-based meal 3 times a day for 8 billion people on this planet? What an arrogant, elitist, outrageous, unsustainable thing to advocate on this day and age when the ice caps are melting. We are borrowing this world from our children. And large-scale animal agriculture is the driving force behind every single one of the environmental disasters we face. That's why the forests are being cut down. The soil is eroding off fodder fields. Most water goes to irrigate alfalfa, corn, and soybeans. Most water is polluted by manure, pesticides, and herbicides off the corn and soybean fields. Most species are driven to extinction because we're taking their land. And the majority of greenhouse gases are produced by 80 billion living creatures, all of them breathing out carbon dioxide. Most are belching out methane. They're eating grains sprayed with ammonia fertilizers that are putting nitrous oxide into the air. And it's our flesh production and consumption is the driving force behind all these disasters we're facing. You say, well, how about transportation? What about all the trucks? Don't tell me the animals produce more than all the diesel trucks on the road. It's a phony question. Don't be seduced by that one. Why? One question. What's in the trucks? The entire farming industry is in those trucks. The entire restaurant industry is in those trucks. The fast food industry is in those trucks. They're full of fuel and fertilizers, tractor parts, and cattle. The diesel fuel is being burned to produce the meat. The meat production has its tentacles into every one of these environmental disasters we face, and that's why these poor bears are on this iceberg, because we got to have those cheap subsidized burgers. Well, I'll just eat fish. We are strip mining the oceans. We are clear cutting the oceans. They are turning into deserts. It's time to let the oceans heal. It's time to let the fish off the hook. We have used fishing up. We've used it up. No matter what it did throughout history, we've used it up already. Let the oceans heal. And we've used meat eating up. If you haven't run into Dr. Richard Opperlander's magnificent book and website called Comfortably Unaware, please go there. Comfortably Unaware is exactly where the meat and dairy folks want us. Just keep eating those burgers. Don't worry about what they do to the planet. Do go to his website, see the videos, and read his wonderful book. It's time to leave caveman thinking behind. Oh, our caveman ancestors, like every Neanderthal, had a mastodon in the freezer and spent all day eating mammoth meat. I'm a caveman. That's nonsense. When you go to Africa and you examine the fossilized species of these people, you see the massive amount of fiber that they were eating. And the reality is that the majority of calories brought into the Paleolithic camp were gathered by the women, who spent all day pulling up starchy roots and tubers and edible grasses and berries and nuts. And that's what our small mouths and grinding teeth are about. This is what really got us through the Paleolithic years. It had nothing to do with these flesh-eating myths that, if they dragged a carcass in, it rotted within days. It just is a fantasy to think that we lived on animal flesh all the time. Didn't happen. A global move to plant-based diet will save all of us as individuals and as species. If we go to a plant-based diet, we'll need so much land to feed everyone. The forests will come back. The greenhouse gases will be absorbed into the trees. The soils will stabilize. The rivers will run clean again. The land and the people would heal again. It's the key to our survival as a species. So my colleagues are slowly getting on board. Here's UC Davis proposing a plant-based diet. Kaiser Healthcare wants their physicians talking about plant-based diets. I just attended the Plantrition Project. Plant-based doctors from around the world came to Oakland to share their understandings. They're having that was one I just attended. American College of Lifestyle Medicine is having their meeting in Orlando. You're all welcome to come. You have a British Society of Lifestyle Medicine, yay, but there are many strong advocates of the paleo and keto diet in that group there, so it's not a guarantee that you're going to get plant-based counseling, but you will get plant-based counseling if you contact someone from Plant-Based Health Professionals UK or in PAN, the Physicians Association for Nutrition. Please take advantage of this, and if you are a healthcare professional, join these folks and help them in their efforts. Lots of information. If you're a healthcare professional, please educate yourself. Take a picture of this one. Every one of these, Cornell, but PCRM, I'll show you there. Jeff, no, these are all wonderful, wonderful sources of information. PCRM is just sterling. In all the CME, they put out evidence-based patterns for weight control, for type 2 diabetes, for heart disease. Go to pcrm.org, Physicians in Training Resources, and you'll have these just for your download. And there's this wonderful app on your cell phone. If you admit a patient with lupus, you'll know just what to feed them. end of this sprint here. They say once you look behind the curtain, you can't pretend you don't know what's behind the curtain. And my intention going to the medical students is to tear down that curtain and say again, you want the most powerful tool, you want the understanding of these diseases, you want to know how to cure your patients. Plant-based diets hold the key. And I ask them a very provocative question. It gets a few docs' backs up. But I say, it basically comes down to this. You get all your patients with these dreadful, dreadful diseases that you're going to spend the majority of your hours treating. You want to heal these people, or don't you? Why'd you go into medicine? Really? You want to heal them? And get real about what they're eating, and get real about the kind of diet that will reverse these diseases. And if you're not a healthcare professional, if you're just a person walking around the body, I'll ask you, do you want to heal yourself or don't you? If you're just putting your toe in the water about this plant-based stuff, I'm saying get into it, boots in. And this is your key to getting healthy and staying out of the clutches of people like me. Okay, so the year of applied nutrition-based lifestyle medicine is dawning, and the plant-based wave is breaking. To my colleagues, I tell them, I'm the happiest doctor I know. You can become the happiest doctor you know. And for all the patients who aren't docs, who just walk around in a body, this is your chance to become the healthiest person you know. A lot of information. I said I'll have this for you in the PDFs, the slides that I gave you. Thank you for your attention, and blessings of health and happiness.